Hello everyone. Today we are going to talk about poliomyelitis, which is very familiar to us by the name polio. So poliomyelitis is a disabling and life-threatening viral infection which is caused by an RNA virus. It is an infection of the human alimentary tract but may also affect the central nervous system in a very small percentage of cases, resulting in the paralysis or possibly death of the person. The legs are the most often affected, although head, neck, and diaphragm muscles are also susceptible to the virus. About 2% of the children and 15 to 30% of the adults die as a result of muscular weakness if they are affected by polio. Next, we look into what causes poliomyelitis. So, poliomyelitis or polio is caused by poliovirus, which can be found in three different serotypes, which are serotype 1, serotype 2, and serotype 3. And we can see that most of the paralytic polio cases are caused by serotype 1 of the poliovirus. Next, how was poliomyelitis diagnosed? So first of all, antibodies to poliovirus are tested in the blood of the person. And we all know that antibodies are proteins that the body produces in response to an invading virus or bacteria. Special test can identify the level of poliovirus specific antibodies, and it establishes that if the person is infected with the virus or not. So in case the person is infected with the virus, what are the treatment that is available for him? So unfortunately, there is no permanent cure for poliomyelitis. So most of the time, some remedies that are recommended to the person are the use of painkillers, physiotherapy. They might be recommended bed rest or antispasmodic medications. They might be given antibiotics, and they may also be recommended the use of mobility aids like crutches, which help them to cope up with the disability. So next, how common is poliovirus and where is it found? So poliomyelitis was found in all the countries before the use of vaccine, that is in the pre-vaccination era. And the use of vaccine from 1954 led to the eradication of polio in developed countries. The eradication strategies reduced the number of endemic countries from 125 in 1988 to 3 in 2014, and these three countries are Afghanistan, Pakistan, and Nigeria, which means that 80% of the world's population is now polio free. Next, we look into how the transmission of poliovirus happens. So poliovirus can be transmitted mainly through two routes. The first one is fecal oral route, and the second one is droplet infection. So fecal oral route is the most important way of transmission of poliomyelitis. This happens when the infection spreads through contaminated fingers or through contaminated water or food or flies, etc., in places where the hygiene is poor. So, for an example, in India, we know that in some rural spaces, open defecation is practiced. So, if a person with polio virus defecates in the public, it might lead to the contamination of water since the feces of the person might contain the virus. So, the people who consume this virus are more susceptible to have polio virus in the future. The second way is through droplet infection. This is rare and it happens when there is a close contact with an infected person. It occurs in the acute phase of the disease when the virus is in the throat of the person who is infected. So next we look into who has an increased risk of being exposed to polio or poliomyelitis. This infection can occur to anyone, but children are more susceptible to polio. The data shows that 50% of the infected people in India are children, and the most vulnerable age is from 6 months to 3 years. There is also a significant difference in the number of male and female affected, and the ratio is 3 males to 1 female, which means that male children are more susceptible to polio than female. So immunization is the most important method to reduce the risk of acquiring poliomyelitis, and these epidemics can be prevented by use of vaccines. which are available, and the two vaccines used are oral polio vaccine and inactivated polio vaccine. Oral polio vaccine or OPV came into use in 1961 and is administered orally, and inactivated polio vaccine came into use in 1955 and is administered through injection. So this is how the IPV or inactivated polio vaccine is given to the children. It is given, the first dose is given when they are 2 months old, the next dose is given when they are 4 months old, the third dose is given when they are 6 to 18 months old, and the fourth dose or the last dose is given when they are 4 to 6 years old. The next one is pulse polio immunization, which is a national program conducted by India. So in 1988, India signed a resolution for the elimination of polio, and it was passed by World Health Assembly. So the pulse polio immunization campaign came into being. This is also known as the National Immunization Day. It began in 1955 and was held for the first time on 6th December 1995 and 20th January 1996. So in high-risk states, many rounds of sub-national immunization days are undertaken, and it is given at least 2 times a year. So this is all about poliomyelitis, and thank you.